Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Many of us have children and grandchildren and great-grandchildren. But anyway, the first one is that we sometimes fail to accept that parenting patterns change with time. They talk about the fact that in the so-called old days, spanking was part of the traditions, and how over time spankings are not even permitted by some. So that's one of the things that is interesting. Of course, the Bible says if uh, you spoil your child, you make them rotten, and they're not going to die from being spanked. But the law says different. So, any comments about that one?
Yeah, I wish that notice came out when I was a kid. I got spanked.
Yes.
Good.
Yeah, I did too. I don't know whether it's good or bad though. Yeah, I remember I spanked my children very little, mostly because my wife was relatively intolerant of spanking. Uh, so I think I spanked my son once. My girls, they were harder to deal with, and they got a few spankings. But how have you handled that as you see your children who handle things so differently? No comments.
Good morning, everybody. Um, Thinking about my childhood, I was the good child, so I didn't get
No,
spanked.
you weren't.
But I
Uh,
didn't get spanked but once, and that's a long story about why. But but when I became an adult and had kids of my own, I did spank them.
hmm.
So uh,
Any
when
other
I felt
comments?
like they really needed it, I spanked them.
No, I,
Yeah,
I
boys,
spanked mine very, very little. I don't think I believed in doing it too much, but I didn't spank them very much.
I think boys need spanking more than girls. And spanking can bring out some of the skills that you didn't know you had. Because I tried to make my mama laugh to get out of spankings, and it worked.
Uh, is that right, Carol?
Yes, he did. And I don't know how he did it. I would get all the fussing at. And then after a certain age, my mother didn't believe in spanking, 12 or something like that. And I wish he would go ahead and spank them fuss. But yeah, I I spanked my children. I never thought about it. You say stop and they don't listen. You yell it, they don't listen. Just take care of it real quick. You know, Pow, stop. You don't even have to use a whole bunch of words. After a while, you could just use your eyes, look at them, and they're fearful. Just bring in the fear a little bit, um, but not excessively. They get a certain age, you try to talk and reason. But when they're 2 and 3 and 1 years old, there's no line of reasoning and talking about timeout. By then, they could have killed themselves. But
Hey,
it's a different generation, and my heart goes out to teachers particularly because, especially when you're in the early elementary age, they'll do silly stuff. They're children. They'll eat the paste, they'll bite somebody or something like that, and you just have to quickly tell them. But when you're trying to talk, you're ignoring the rest of the children who and become complete bedlam. And even when they're older, I don't believe in teachers paddling because the racial epidemic. Black people don't want white people beating on their children. White people don't want black teachers beating on their children. So they got to stop their classroom instruction and call all the time. And it's their word against the kids' word, or sometimes, a lot of times the parents believe it when it's right there on the spot. But you got to stop your instructional time to call, to cajole, or if you can't reach the parent, that child is still bail them or send them to the principal's office who can't handle them anyway. So it's a roundabout circle. But yes, when they're young, get the fear of them, like the fear of the Lord. A lot of them, they don't fear God because they don't fear nobody, because there's no retribution. But not to the extent of our foreparents. Our parents didn't have that knowledge, so they beat you with anything they could get their hands on. And sometimes it was cruel, whether you go out there and get your own switch, or you get the belt, or you get the back of their hand and you get slapped. All these things predicated because no one has taught them. I guess a generation, but I'm thinking about the children who never are disciplined, especially little white boys. They still grow up, they take over the world. So, and they're still very cruel. So give me the answer. What the scripture says is right, while they're young, get to them.
Yeah.
But I just feel sorry now because the law and nobody can touch the children, including the parents.
I remember one Christmas, Santa Claus left my brother and I a big bunch of switches, and my mother used every one of them.
The second one is blaming your child's partner. In other words, your child isn't the problem. Your child's partner is the problem. And that's one of the issues that I don't know how many of you fall into that one. The next one is assuming it's the parent's fault when a grandchild is struggling. When you're a grandparent and the child is having problems, it's all the parent's fault, and not the child. It's the parent's fault. Then the fourth one.
I can understand that one because my grandson is perfect.
Yeah, right. Okay.
That's a fallacy. Even in the scriptures, it says, "Be the child." Why do we blame the parents? We blame the parents, or particularly the mother, on how children turn out. If that's the case, and they're taught the right thing, sometimes it is the parents' fault because they're not disciplining their children. But even David had a bad child that wanted to kill him.
Absolutely.
Why do they always blame the parent for everything in the scriptures? It gives us an example of humanity. Good parents had bad children, and nothing you could do or say, you try to discipline, they inevitably go toward that evil one, and you're trying to beat the crap out of them, beat the devil out of them. They're stubborn, and etc. And they come from gentle, wonderful parents, because we are all wonderful and we want the best for our children. But every once in a while in that crop, and then they give the parents, oh, that child is just wonderful. And they'll give the parents their due. But sometimes they just come out sweet and nice. Nothing, you try it. They all come out with their different personalities. All of my grandchildren, they all have personalities, and I'm grateful with how their parents discipline. They got enough sense to know how to act in front of our face, whether they do it behind our backs or not. But we try to train, each one of us try to train our children the best we can. Finish college, do this and that. But sometimes something else circumvents and gets in the muddle. And if all good parents try to raise good children, all of us would be perfect and not make any mistakes. And that's the end of that dialogue.
One thing that you said that I think is so important now as it was before, and that is taking on responsibility for the children. I always knew that the main disciplinarians were my parents, but I also knew that I was disciplined and watched over by Mrs. Allen, Mr. Montgomery, Miss Ploss, my uncles, my aunts. It was more of a communal thing. And, our research in HIV disease pointed out how specifically those who did not feel like community put themselves at greater risk. And now so many of us have to be the community for so many children.
The next one is making it a fight instead of a discussion. In other words, we kind of give them rules instead of discussing it with them. So that's something that may be harder to do than you think, because you have kind of rules and you want them to follow your rules, when in point of fact, you're not the rule maker anymore. And so that's an issue that's the fourth one. And the fifth one is weighing it in too often, especially when you weren't asked. Giving your opinion when nobody asked for your opinion. As a they say we're wiser and older. And so sometimes we need to sit back and listen, and then if they want our opinion and ask for it, give it to them. If not, just be a quiet grandparent. What are your thoughts about those five reasons? Any other additional thoughts, comments?
I agree about the opinion, because that goes for everybody. If they didn't ask for it, they're not going to listen to you no how, and it's just a waste of breath. And if they ask for it, they already got their mind made up. And if it sounds logical and they didn't have a clue, then maybe they will listen. But most people, think about yourselves when your parents gave you advice. You think, oh, that's old fashioned, that's back in the day. Well, these children are still thinking the same thing unless they really, really say, oh, that's a good perspective. And discussion does help when you're talking with children if they're reasonable. But that's why I admire my husband so much, because once when our son was 13 and he was illogical and he thought what he was saying was making sense, my husband said something that the books, and we both had school psychology, that no, you will no longer think for yourself until I tell you think clearly. You will do just the opposite. He wanted to quit school and everything else and join this go-go band or something like that. And he did not like DC Youth Orchestra or something. He just wanted this and that. So my husband told him this, and he just said, oh, okay, and took it as that. So we say go to school, continue classical music until we tell you that your head is turned on tight. Sometimes they're not really making rational, they're just doing what they feel like, and their parents sometimes have to intervene and say, you're not logical, just go by my rules. But sometimes it's good to have a discussion if they're in that logical mode. But you have to remember, they're children. Even young adults, we made mistakes as young adults, and we're thinking what we're thinking is logical. But until somebody can crack that nut, it's not. Some parents have better control than other parents.
Okay, thank you. The next article that I thought was worthy of sharing is one that is a little kind
Dr.
of,
Perez has her hand up.
oh, yes, Dr. Bryce.
On that note about whether we should speak up and give advice, definitely I hear what you say as it relates to never give advice unless it's sought. But I also feel a responsibility that parenting never ends. And, you know, sometimes the hardest thing I have to do is to intervene or to, you know, I seek prayer to find a way to get it in, as opposed to abdicating my role as mother or elder in situations that I think require wisdom. And I think now, especially for a lot of our young people, I mean, I did adolescent medicine. I mean, I dealt with people who were incarcerated for significant crimes as adolescents, murder, and you know, just all those kinds of things. And I have never ever been hurt. But I think it's important that we be creative about sharing wisdom and guidance.
Okay, any other comments? The second article is one that's a little scarier. It talks about the fact that lung cancer kills more people than any other cancer. Uh, Almost twice as many people die from lung cancers that do from any other cancers. And one of the reasons that they think this is the case is because people think of smoking as the number one cause for cancer, which is accurate. But we're now in a situation where most people don't smoke in this country. And still, we have lung cancer as the largest cause of cancer deaths in this country. It kills more people than breast, colon, and prostate put together. And the thinking is that if more people, for example, between the age of 40 to 85, had low dose CAT scans, that screening alone, regardless of whether they smoked or not, would prevent late diagnosis of lung cancer. 90% of lung cancers, if they're diagnosed early, are treatable and curable. But most of the cancers that are diagnosed late, and treatment is unsuccessful. And so the idea of a low dose CAT scan, lung CAT scan, is recommended for people who are between the ages of 40 to 85, whether they're smokers or not. And the thinking is that 80% of the people who have lung cancer diagnosed late because they are not screened. And so waiting for symptoms, by the time you get symptoms, it's 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 far too late, and by that time the cancer may already have spread. Uh, and so the thinking is that having the low dose CAT scan of the lung as a screening process might save thousands of lives each year. Uh, and it's thought that if you are eligible, which means that you're between the age of 40 and 85, the low dose CAT scan is something that you should do. And you shouldn't wait for symptoms because a dry cough, chest pressure, unexplained weight loss, coughing blood, and that kind of thing are signs of late lung cancer. And by the time that happens, the diagnosis is the cure rate is only about 10%. Darryl.
Should this be an annual low dose CAT scan? And how
Annual,
easy is how
annual.
easy it is? How easy is it for your doctor to get your doctor to prescribe it so that you get it paid by insurance?
It's easy and it will, insurance will cover it. Any other comments about this interesting article that talks about lung cancer as a treatable disease when it's diagnosed early? John Buchanan.
Betty was before me.
Oh, you you
Go
can
ahead,
go
Betty.
on, John. No, I was just thinking, Dr. Callender, when you said that even though we aren't smoking as much, it's still more lung cancer. I'm wondering if it's stuff in the air or rather than just, everybody think about smoking in lung cancer, but there must be some other sources because if the rate is still high and we aren't smoking as much as we were, something else is going on.
Yes, it is. But and then air pollution is part of the problem. John?
My thought is that um, if you recall, maybe 30 plus years ago, you would go in an establishment and it would be full of smoke. I remember even in church, people would smoke it in church. Um, so I'm thinking that damage was done, many years ago that was on, it was hidden and it appears now. That's just my feeling for the amount of lung cancer that's out there right now. It's a delayed reaction to smoking. I smoked personally for about 20 plus years, but I've quit smoking now for over 30 years. So I've quit longer than I smoked, but it was an everyday thing. Uh, so I'm thinking that the effect of uh, early in life smoking uh, could be one of the causes of that amount of lung cancer now. Thanks.
Thanks for sharing. Darryl?
Yeah, I'm reading the internet and it says that radon that it can build up in homes and buildings and it's the leading cause of lung cancer in non-smokers. The other thing, of course, is air pollution. If you live in a city environment where there's a lot of air pollution, it's going to get in your home or when you're outside. And you can get air pollution from things like gas burners on stoves and ovens. If you're not venting with your hood fan all the time that your gas stove or gas oven is on, you're introducing some volatile organic compounds into the air, which could cause lung cancer.
Thank you for sharing. Any other comments? If not, we can move on to the articles. John Buchanan. This is it, every time we share, we have at least one or two articles where the doctors misdiagnose something and turns out to be brain cancer or something that is devastating. So that, and more often than not, they say it's anxiety or something else. Of course, in this case, it was a tumor in the brain, and so it's becoming uh, very common to find that the doctors miss some of the diagnoses. Uh, and this is a good example of it. I don't know what to say except that if you have go to one doctor and they aren't able to find it, there's a second opinion is often advisable because it's always lamentable when uh, the doctor had a chance to pick it up early but missed it, and the patient then finds out that the doctor missed the diagnosis and they've had a treatable illness. And at least one article in every session uh, points this out. Any comments on uh, the fact that not too infrequently doctors miss the diagnosis and patients suffer as a consequence? Any comments, thoughts?
Brief comment, Doc. I'm feeling like uh, this is a good recommendation for us if we feel something, and it's not uh, corrected or treated properly, and we need to be persistent, talking to our doctor about it.
Right, and not hesitate to get a second opinion. Right. Okay. Any other comments? If not, go to the next. This is an interesting concern about the new flu strain, which is, as always is the case, what happens in Australia uh, is a mirror of what's going to happen to us. And this mutated version of the flu is wreaking havoc across Australia and other parts of the world. And so it's an expectation that we will have extraordinarily violent flu season this year. And so the recommendation is be sure to get your vaccine, but also protect yourself the best way you can. Because usually what happens in Australia is what happens here in the United States later on. And the warnings are, as you see here, as we know well, the fever, cough, sore throat, runny nose, body aches, headaches, fatigue, etc. Uh, well, will the flu vaccine, the question is, to what extent will it help? Some years it's 50% and above. Some years it's under 50%. So what will it be this year? I don't know. But be careful wearing a mask and um, washing your hands is still the safest thing to do. Any other comments as we are right in the midst of the flu season now? Okay, no comment. Let's go to the next article.
I have a comment. Would you agree that it's important for those, especially at risk seniors, to not only get the flu and COVID, but RSV?
Oh, I think it's mandatory. Yeah, RSV. If you're over 65, you should have RSV. Of course, the evidence is that one RSV vaccination is adequate for people who are over 65. But yes, RSV is an important part of the vaccinations that you should have, particularly if you're over 65. And this is another article that says pretty much the same thing, that this is likely to be a tough year for the flu. And as Dr. Perez has indicated, that means RSV as well as the flu are problematical for us. And so the vaccine is an important preventative thing. Remember, it prevents hospitalizations and death. Any other comments? Okay. Then, of course, they don't say much about the pneumonia vaccines, but it's expected that you would have that as well. Okay, let's go to the next article, and if there are no additional comments. Advice to help keep patients healthy during the holidays. I think one of the most important advices is if you have a cold or fever, that you should stay home and not go to work. Keep it to yourself. And I think this is one of the most important recommendations you can have. And wearing a mask and washing your hands frequently is also good advice. And as was mentioned, the RSV virus as well. I guess the good news is that one RSV vaccination is enough for an adult over 65. And remember for the flu vaccine, you need to get the double dose if you're over 65. And then in this season, the foodborne illness is salmonella and listeria, and those still are problematic, as well as those who are doing international travel have to be careful about catching some diseases. Having the proper vaccinations ahead of time is very preventative, and that's why being updated with your vaccinations is absolutely critical. And keeping a record of them for yourself is very important. Your doctor may have it, but you should have it as well. John Buchanan.
Yeah, let me go back up here. I saw something I didn't understand. Necrotizing encephalopathy.
What does that mean?
Yes, sir.
Yeah, well, encephalopathy means that your brain is not working well, and so you become comatose or unconscious. And uh, when you have a situation where the brain, you get drowsy and you're not functioning, it's likely to be fatal. And this is a complication of influenza as well.
Mm. Wow. Okay. And my other question is that are these new strains so new that the vaccines that we got last month won't work, or will they still work?
Well, we don't know. That's the truth of the matter is that the vaccines may be more than 50% effective, or they may not be. So the fact that they have been so problematical in Australia and other places suggests that uh, it may not be the case for us, but we really don't know. We won't know until the season's over. That's one of the problems. They use the experience in Australia and other parts of the globe as the best prognosticator of what we will go through. And that has been the situation that whether the vaccine is going to prevent it in more than 50% of the cases is something we really don't know until afterwards. Dr. Perez?
And the fact that we're not doing surveillance or communicating with our public health partners globally is also very detrimental to us because of our secretary.
Yeah. Well, because of our administration, secretary included, of course, he's a consequence of our presidential um, selection. Okay, let's go to the next article as we go through this season, which and who should the primary care doctor look to for vaccine recommendations in this area in which the CDC, as Dr. Perez has mentioned, has become more of a political football than an actual advisor for health. This becomes an issue, and all of the regions are making recommendations on their own because they feel that the CDC advisory committee has been less than helpful. And so many states are coming up with their own recommendations. Uh, we're in a situation in which the uh, number of people who are vaccinated is decreasing rather than increasing. And so, so it is more likely that we will have heavy uh, influenza and other viral infections because of because of the decreased number of people who are actually vaccinated. Any other comments? It becomes more and more difficult to uh, get advice from the CDC. Dr. Perez?
One other issue is the impact that all of this administration is having on science and how our young people believe, trust, and even will pursue it in the future. And like you started out with the article about grandparents, it's so important that our opinions and our thoughts and discussion around health and science emanate from us during this very difficult administration.
Thank you for sharing. Um, and of course, the COVID vaccine is under new scrutiny with the new administration. John Buchanan?
You know, that bias against science, okay? That reminds me of I think I was a teacher at the time in high school, and you know the average kid or maybe the below average kid would almost um, put down the smart kids when we had an awards assembly. You know, some of the smart kids wouldn't even go up to get their awards because they were ostracized by the below average kids, I would say. So I think the same thing may apply to science in general. You know, scientists, just that word means you're a smart person. So anybody who's not smart might put down, you know, being a hater might put down the scientists because they're not. Something to think about.
Yep. Thank you for sharing, John. Uh, and as you, Dr. Perez?
I don't know who participated or saw 60 Minutes this week, but they talked about genetic engineering, new science, and in all of the global categories, there might have been, I know there was a school in the United States, a high school student that had come up with a way of diagnosing, the disease that you get from deer. Um, and these were high school students, and they went so far as to also have some theories about how better to treat it. The difference was because of these things that are occurring now with this administration and anti science, we are going in the wrong direction. All of the global awards, all the new things were happening. China had double-digit numbers of schools and groups involved. The United States might have had one. This is having very serious consequences for us and for our people. Its impact is generational.
Okay, any other comments about the COVID and its implications and, of course, new scrutiny and identifying consequences of the COVID vaccine, which uh, has its issues, but of course it saved millions of lives. And so it's going to be interesting as time evolves and we look back on the COVID vaccinations, which were remarkable in the time it took for us to come up with the vaccinations and to see what impact it had upon all other diseases. This is interesting about the Korean article, but it'll be interesting to see how it is across the globe, including the United States. So time will tell on that. Any other comments about that? And I think over time, we'll look back and see exactly what is the impact, plus and minus, of all of the good, bad, the ugly, and the wonderful as a consequence of the COVID vaccine and the lives it saved and the lives that weren't saved. Darryl?
Yeah, one thing we learned during COVID is that the duration, uh, the duration of your exposure really significantly impacts how likely you are to catch it, to catch whatever respiratory disease. Um, like worst case scenario is if is it possible to catch something from a single sneeze? And okay, how you should react to it. So, internet says best course of action: you get that sneeze, leave the area immediately, while also trying to avoid inhaling deeply for a few seconds, and then washing your hands or sanitizing them. So, I guess it's possible to avoid catching it from a single sneeze, but you gotta leave the area right away. Don't breathe for a while. Wash your hands.
Any other comments? If not, we'll go to the next article. This is this is something that Kennedy has long and and actually Trump have long tried to identify a link between autism and vaccinations, and the battle continues. And I think what we need to do is to be scientific and honest about it, and not falsely accuse uh, the vaccine of being associated with autism, when in point of fact, we don't know what is causing autism. And the link is not there. So, but this is something that they have committed themselves to proving, whether it's true or not. And this uh, article talks about the discredited articles that they use to base their opinions on. So this is an ongoing battle that began in Trump's administration before Obama, and have continued with this new administration. Any comments? John Buchanan?
Yeah, so the result of this is that people don't trust what the government says. Okay. Uh, both positive and negative. So if the government says to do one thing, there's going to be enough people to not believe it. It's going to make it ineffective.
And it's going to decrease the vaccination rate. Right. Okay, any other comments? It's an interesting time we live in. Yeah. This is an article that says if you got pre-diabetes, that you have a faster decline in your kidney function than if you didn't have pre-diabetes. And this is to drive you, actually, you've got pre-diabetes, to keep that hemoglobin A1C less than 6, because it's clear now that diabetes as well as pre-diabetes is associated with decreasing renal function. As we know, diabetes is the #1 cause of kidney failure, and hypertension is a close second. But so pre-diabetes as well is linked with a decrease in kidney function as well. So both are undesirable. John Buchanan.
Sorry, I left it up. No.
Oh, okay. All right. Any other comment about the association of diabetes and pre-diabetes with kidney damage?
One quick question. In a normal uh, check for annual health, when you see your primary physician, would they normally check for blood sugar? Is that part of a normal?
Yes. Yes.
And
Yes.
what is that called when you
Glucose,
get
blood glucose. They do either a blood glucose level or a hemoglobin A1C. The hemoglobin A1C is the preferred and most accurate one, but having a blood sugar of over 100 is diagnostic of diabetes.
Do we have to request that? Are you saying
No,
normal?
every screen for somebody who's going to be screened as over for annual is going to have a blood glucose level.
That's part of the annual physical anyway.
Yes.
Okay.
Yes.
Thank you.
And
Now they
Dr.
don't have
Callender,
the glomerular filtration rate, but I think uh, urine protein is one of the things that they should do, but they tend not to do because that's the earliest sign of kidney disease is if you have protein in the urine. But they will generally do glucose, BUN, and creatinine.
so do they check just from your when they take blood, that's all they need to do is just a regular blood?
Click the finger.
What are you asking?
As far as getting tested for diabetes,
Yeah,
is it
blood sugars
ju-
is something they always
just
test for.
just when they take the regular vial of blood,
That's
they
correct.
do it from that? Okay.
Yeah. Any other comments? If not, we'll go to the next one. 10 ultra processed foods you should never buy again. This is something that it's good to share. We've shared this almost every week. Pizza that people love seems to be number one, but that doesn't stop the popularity of pizza. And then it's always amazing to me to see that pizza's diet soft drinks still very popular, in spite of most of the studies that show its unhealthiness. Ice cream and biscuits, and we still love ice cream. We still love biscuits. Processed red meats still have steakhouses, and we love bacon. And so it's interesting how we know the ultra processed foods. White bread, we know that brown bread is preferred, but white bread still a top seller. Low fat flavored yogurt are sweetened. Uh, Orange juice has so much sugar in it that it is relatively undesirable, but it's still one of the most popular drinks. Booze, of course, we know it affects just about all organs negatively, but it remains. Coconut oil is surprised to see on this list. Because, olive oil, of course, is good, but coconut oil has a reputation for some reason. And many other ultra processed foods, many of all lead to our chronic diseases and people over 65 being very common. Any comments about this? As you can see that none of this is new, but it's still, and you can see how we talk a lot about broccoli, turnips, bananas, and butter. So we know what's good for us. The question is, why don't we take the advice that's given us and change our eating habits? Any comments?
I was definitely disappointed about the ice cream, but I knew it.
Me too. I, I was kind of disappointed with the orange juice, but the orange juice is not, I mean, we can switch to oranges. Oranges are fine, but no orange juice. Is that what they're saying?
Yeah, that's what they're saying.
Got so
Uh,
much sugar in it, added sugar.
Right. Mhm.
Okay, okay. Michael's
Oranges,
gonna die if he can't get his
apples,
bacon.
but not no orange juice, no applesauce. And of course, applesauce is delicious as well.
Me too on the bacon, but I get lower sodium bacon.
Yeah. Yeah, they have it. Yeah.
Mm.
Okay, let's go to the next article. This is interesting that there's another association of red meat and red and processed meat increase the risk of pancreatic cancer. Uh, right now, pancreatic cancer is considered one of the most aggressive types of cancer, and it has not decreased the number of people who eat red meat, but this is an observation that we've made, although we have many people who eat red meat who don't have pancreatic cancer, but still the association remains. Of course, we need much more research since pancreatic cancer is with us, and we see every day more people that we know of who have pancreatic cancer. And sometimes you wonder, we have all this information, so it's not like it's a secret, but the steakhouses are still full. So information is power. But, we have so much information that a plant-based diet is healthier, but yet we still eat so much processed and ultra-processed meats. The conclusion, I think, is an interesting one. Your overall lifestyle matters more than any single food. So your meditation, your exercise, and your dietary habits all go together to increase your immune system and decrease your likelihood to have these inflammatory diseases which plague us.
Uh, Dr. Callender, the other interesting thing for me is that some of these people live to be well over 100 years old, and they don't have any particular diet. They just it's a regular diet, and yet they live. You know, my father was almost 102, and he didn't eat anything special.
Right. But, the question is, are these exceptions to the rule? And I don't know the answer to that question, but your observation is quite correct. But remember, uh, these centenarians are rare. They're not everyday occurrences. Uh, so much so that we celebrate when people become centenarians. Uh, indicating that most people don't make it to that, and how the unhealthy diet contributes to that is also evident. Any other comments on your observation? Which is very accurate, you're right. But the fact that they are exceptions to the rule suggests that they are exceptions. Any other comments about this? It's the best time to eat for weight loss, knowing what to eat and how you can eat healthier, as Darryl has been trying to demonstrate to us every week. It's something that, when we've had our dietary nutritionists talk to us, they tell us the foods that we should be eating and how we should tailor our plates with more vegetables and less carbohydrate. But in terms of having a big breakfast, small lunch and a small dinner, and when to eat, whether to eat before 6 or after 6, all of these intermittent fasting and meditation, all these things, all part of lifestyle. Some people recommend a big breakfast and a small dinner. So it varies. And this article talks about see what she says. The sweet spot is 4 to 5 hours after lunch, in between at least 2 hours before bed. And Betty has told us that she eats after 4 and doesn't eat after 4, and that works well for her. I've seen many articles that say don't eat after 6. And they do well as well. But balancing your plate is something that just about all nutritionists emphasize. And not considering an after dinner snack seems to be among the best advices. But they say consider an after dinner snack. Any other comments on this advice from the nutritionist in terms of eating habits that are the most ideal? Any comments?
It's nice. I was happy to see that they didn't do a time for breakfast or a time for lunch or a time for dinner,
Right, they didn't.
because being retired, you lots of times you sleep late. In this household, that's almost every day. So our breakfast is at noon. So, but I try, and I'm still on that, sort of on the diet, but I've kind of gotten off of it a little bit. But and the scale is still fine. I'm still at my 140, 42, I think, when I weighed on the first, 142.
So you're
But
still not eating after 4, or has that?
I'm eating mostly before 4, but there are some times when I eat after 4.
And junk food.
And my husband is chiming in saying I eat junk food after 4, which is true. But I'm still doing pretty good with it. But I was just glad that they didn't put a time frame on your meals because we eat so many crazy hours here.
Okay, any other comments? How do they put within the first 2 hours of waking up? That's interesting. Okay, well, let's go to the next article. Well, most of the articles are now catching up to the comments we made much earlier that GLP-1s are a start, not a solution, and lifestyle, the way you live your life and the foods you eat determine how you survive. GLPs are the miracle drug of the 21st century, and we're going to see more and more articles on that and more research on that. And but I think it's important to balance it with recognizing that we don't know all of the answers on the importance of the GLP-1 drugs. We know that they seem to be the treatment for most everything, but they have side effects. And so when your doctor uses them, you have to be communicating with your doctors in terms of the side effects so that it is helpful. We've seen GLP drugs that has been beneficial for almost every organ system. And so whether or not it's the whole answer or just part of the answer remains to be seen as we do tests from time to time and look at the good, bad, and the ugly about the drugs. And as we use them more, we'll learn more about them and unmask how great they are, as well as what are the limitations on their use. One thing is clear, though, that they're not a standalone, and that the type of food you eat, the exercise you do, the meditations, uh, the resistance exercises, all those things put together to determine how your immune system is going to respond to you and inflammation. But make no mistake about it, they are powerful drugs that will have a great impact on our future. Any other comments about the GLP-1 drugs and how they're making their mark on science, and many research projects are now being done to identify the good, the bad, and the ugly of the GLP-1 drugs. Any comment? I don't see any hands, but this is an interesting article about clumsiness, indicating that this may be a neurological evidence that something's wrong. If your clumsiness is increasing, um, maybe you need to see your neurologist. Now, seeing a neurologist is more than a notion, because they aren't as common as you'd like, and all neurologists are not taking new patients. But clumsiness is one manifestation of your neurological system. We talked about gait and hand grip and other things, but clumsiness is something that also um, factors into it. And if so, your clumsiness is increasing, it's not a good sign. If it's decreasing, it's a better sign. And if it is increasing, having a neurologic evaluation is a good idea. I think we don't talk as much about the neurologist as we talk about the urologist and the other ologists, but the neurologist, his or her evaluation of the nervous system uh, and your ability to get around and be mobile becomes a very important aspect of your health. Any comments about this aspect that as you age, your your mobility and motility is affected, but so is your neurological system. Darryl?
Well, if you do see a neurologist, don't be surprised if they seem to be a little down, depressed, bad attitude people, because they work long hours. They usually have high patient workloads. Um, People with neurological problems tend to be depressed, and neurologists seem to have higher rates of depression than other medical professionals. Uh, I went to a neurologist for my carpal tunnel, and he's not a cheerful guy at all. Uh, but he's not a one-off. He's pretty typical, according to the internet anyway, of neurologists.
Thank you for sharing. Hmm.
Yeah, I included this article because yeah, I am famously famously clumsy. I mean, I've spilled cups of coffee on the floor. Um, Many times when I grab something, I don't grab it properly and it slips out of my hand. So I don't know if I should see a neurologist or not. But you know, I, I focus on this article because it rings the bell.
Okay. Well, having a neurological evaluation is eye-opening, as Darryl said. They are a different breed. Yeah. Okay, if there's no other comments, uh, it seems like almost every month we have another article on guide to blood pressure. And one of the things that's very common is the fact that the way that your doctor takes your blood pressure varies from office to office. And whether the in-office measurement is accurate or not varies as well. And the pressure that you take at home may well be the most accurate of all, especially if you take it uh, under ideal circumstances. And often in the office, pressures are not taken in the ideal circumstances. And this article talks about the many sources for inaccuracy. And it's almost frightening when you think of the way in which you may have had your blood pressure taken when you were in the office. Have you had uh, have you had the right type of pressure apparatus used? Have you had multiple measurements? Uh, uh, Is the blood pressure different in the office than it is at home? Uh, do they take time to let you recover from other circumstances? These are all issues that come into play. John Buchanan?
Yeah, I always wondered about when I have an appointment with my doctor. They say, get there uh, like 15 minutes before your appointment. But I think they should tell you because, I remember one time I couldn't find a parking space and I was late. So I had to run to get to the doctor. And I got there, and 1 minute after I got there, you know, come on in. The doctor's ready for you. And my pressure was like 150 something. And they came back later and it was still elevated. So I think they ought to tell you, to get there, not just to recommend it, but to insist that you get there, uh, you know, 10, 15 minutes before your appointment so that your blood pressure will be like normal. Thanks.
Yeah, thanks for sharing, because I think that's important. And also whether the sphygmomanometer that they use, whether it's one that's appropriate for your forearm or arm. And then the fact that they take multiple readings is important. Uh, and then finally, how does it compare with the blood pressure that you take at home under ideal circumstances? Because at home you're going to wait, take time. You're going to because if you're focusing on something else or something, anxiety plays a role in the blood pressure as well. So many factors. That's why I think it's so important to have a sphygmomanometer at home and take your pressures at home and then record them and then take them with you to the doctor's office so they can see what your vital signs are at home. And most of the sphygmomanometers cost less than $100. And every house should have a sphygmomanometer so you can measure your own pressure at home under ideal circumstances. Any other comments?
How would you, they say they should be calibrated. How would you calibrate your home sphygmomanometer?
Well, what you do is you take it to the office and have the nurse and the doctor uh, check it and see if it's seems to be calibrated well. And that's the best way to calibrate it is to uh, take it with you to the doctor's office and let them uh, measure your blood pressure. Any other comments or questions? And people who are unusually large or small may need to have this calibration that you speak of in order to identify whether the cuff is too big or too small, because that makes a difference in the pressure that's recorded. Whether the pressure is 120 over 80 or 130 over 80 or 90 is not as important as uh, the changes that occur in the pressure. John Buchanan.
Sorry, I just left that up, even though I did have another idea though. Aneroid. What's the idea of aneroid sphygmomanometers?
Aneroid is the commonest blood pressure machine that they have. Betty?
Yes. So I'm thinking that my husband and I, it's about 100-pound difference in our weight. So are you saying that maybe we should have separate blood pressure machine?
More than likely, yeah. Yes.
Okay. All right.
I would say if not machine, then different cuffs though.
Cuffs, yeah.
Yeah.
Cuffs.
Okay.
Okay. This is a topic that has had a lot of discussion about treatment-resistant depression. Been a lot of discussion about resistant depression in elderly, resistant depression in those under 65, and relatively young people. It's clear that it is associated with untreated hypothyroidism, with iron deficiency, vitamin D deficiency, and SAD, the seasonal affective disorder as well. And we also have, there's evidence that even surgery may be a benefit as well as anticonvulsive treatments in the elderly, so that the traditional SRS medications are standard for depression, but there's circumstances in which they aren't effective. And that's where you have the treatment-resistant depression, in which psychotherapy as well as the non-traditional medic treatments are of benefit. And there is apparently a difference in the seniors who have a depression and younger people who have depression. And one of the biggest problems is that the side effects that the medications that they use to treat depression sometimes are more difficult to manage than the depression itself. And so the patients with depression don't take the medication. And this is when you need to have additional treatment-resistant depression, depressive medications. And this is something that becomes it's like a mental health professional issue. Because depression is associated with suicidal ideations and other issues, and we have so many people who we're surprised at who commit suicide, that the management of depression becomes a very important aspect. And electroconvulsive therapy, particularly in the elderly, becomes something that is used more than you would think. Lucy?
It's real important for our community, especially at this time, given what we've gone through in 2025. Just people have had the rug taken from underneath them in many situations, or the fear or threat of it. And it's just so important. Um, and we have to be courageous about, lighting into each other. We tend to be very, very secretive. And we need each other, and we need to talk. And, maybe it's because of a scripture or the Holy Spirit or whatever. But I sure don't want to have regrets or the blood of somebody else on my hands.
Well, this is the season, as you mentioned, that suicide is commonest when we have holidays like Thanksgiving and Christmas and New Year's, and significant others are missing, and this suicidal tendencies are greater than ever. And so your point is well taken that this is the season that we need each other more than ever. And uh, the one thing about the holiday season is that it's the time that you're used to having people with you, and those people who are with you are no longer there. Then it becomes a period that isn't so joyous. And as a consequence, it's the period in which the suicidal rates are at the highest. And so, whatever we can do to help people uh, in this season in which uh, we like to think of the joyous nature of the season, but it's also the season in which is associated with more suicides than anything else. Any other additional comments on this observation of the season we're in right now?
Reach out to your neurologist.
To your what?
Reach out to your neurologist.
Neurologists or psychiatrists or psychologists as well. Yeah. Okay, I think that will be the last article for the day. 10:30. So, well, glad that we're all together again after Thanksgiving, and God has blessed us, and we're all grateful for one another. And so, look forward to next week to once again uh, try to learn about how to stay alive and how to thrive.